Hey, ladies and gentlemen, this is Vishak here, and welcome to another episode of Lean Addict. We have a very special guest. He's a multifaceted figure. He's an MBBS and MD in medicine. He's a researcher who has published many national and international journals in medical science and clinical research. Ladies and gentlemen, help me in welcoming Dr. Chaitanya. Good to have
Hi.
you here.
Hi. Thank you so much for having me here. That was a very extremely flattering introduction, but thank you so much.
You're welcome. So today's topic, as we have discussed, it's about thyroid, where most people are facing. A lot of people are facing about this issue. So can we just jump
Yeah.
into the question, or you want to just give a quick introduction about that how it can be approached?
Yeah. Sure. So thyroid dysfunction and thyroid disorders are one of the most common disorders that we are seeing, not just now, but it's been over the last couple of decades. The initial problems were basically due to iodine deficiency, which is something that was very common in developing countries like ours. But given the last 2 decades, changes in food standards and safeties have reduced that. But the burden of thyroid disease still remains. And we've realized that majority of thyroid disease that we encounter nowadays has to do with autoimmune diseases. And the autoimmune disease spectrum nowadays has become really prevalent, not only just in India, but across the world. And a lot of patients find difficulty in dealing with thyroid issues. We have a lot of patients who've come with thyroid issues for the last few years who find it difficult not only just to take the medication, but also to deal with the changes that come with thyroid. So it's a very important facet of medicine nowadays, and there's a lot of research going into it, into how to deal with this issue. It is a disease initially considered to be only of the middle age, but now we've found thyroid issues ranging from a newborn infant and a 1-year-old right up to an adult or an elderly person above the age of 60. So the whole spectrum presents to us.
So that the beginning stages somewhere from 20 to 25 years, something like that, or
Yes. So the most common patients will be between the ages of 20 to 40. That's when we most commonly see it. There's a small spike at puberty between the ages of 12 to 16. That is because of the hormonal changes that we go through. But the majority of diseases we see are between 20 to 40. But there is also another small spike in the incidence above the age of 60 as well, especially given the number of drugs we use for various other modalities or various other diseases can lead to thyroid dysfunction. So we're seeing that it presents at all age group, but the most common age group is between 20 to 40.
Okay. So just shooting the first question, right? So what exactly is thyroid and what are its types?
Okay. So the thyroid is what we call a very important endocrine gland. An endocrine gland is a gland which secretes hormones which are required for the basic functioning of various parts of the body. The thyroid gland is located in the neck, and it's a small butterfly-shaped gland which secretes a very important hormone called thyroxine, which is required for the function of almost every organ system in the body, be it the central nervous system, be it the brain, the heart, other hormonal functions. Your basic metabolic requirements require a basic level of thyroid functioning. And so any abnormalities in the thyroid can lead to problems with not just one system, but every system in the body, which is why patients come with such different type of manifestations. So normally our thyroid secretes a minimal amount of hormones a day for us to maintain our basic activities. You have two types of disorders. One where the thyroid doesn't work adequately, which we call hypo thyroidism. And we have where the thyroid overfunctions, which is hyperthyroidism. Thyroid overfunctioning contributes only about 10 to 15% of the cases that visit our outpatient department. 80 to 85% is by hypothyroidism, where the thyroid doesn't function as it should. As a result of this, the hormonal levels in the body dip, and we have various manifestations because of this, because a lot of basic metabolic functions of the body require thyroxine. And when you don't have that, it leads to manifestations in every organ system. Most commonly, patients come to us with weight gain, where they contribute at least a 5 or 10 kg weight gain. They come to us with general lassitude. Doctor, I don't feel like doing any work. My mood is off. Lethargy. I'm not able to exercise like I used to. I feel cold all the time. I just don't feel like doing anything. My sleep They either sleep a lot or their sleep is disturbed. They come to us with constipation, and women come to us with menstrual irregularities, with problems with their cycles, which are commonly very, very difficult to treat, and they cause a lot of distress to the patient. So these are the most common manifestations with which they come, weight gain being the most common. Some patients can also come to you with a voice change and swelling of the face, which is a very key indicator to us that there could be something wrong with the thyroid. These are all symptoms of hypothyroidism or thyroid underfunction.
Okay.
On the other end, when you have increased thyroid function, the patient usually comes with the exact opposite. Weight loss, they're hyperactive, they always feel palpitations, they're sweating all the time, they can have loose stools, again, menstrual irregularities. So it's the exact opposite that they come to us with. They can have tremors of the hand. They say, sir, we're very anxious all the time. My heart's always pounding. I can't deal with stress. And I have heat intolerance. I can't tolerate heat. Whereas hypothyroidism, I can't tolerate cold. So this is the extreme spectrum that we encounter. And identifying them in the OPD is often a challenge, especially if they come with some non-specific symptoms.
So it also affects the mood, is it?
Yes. So the American Psychiatry Association and the Indian Psychiatry Association have found that depression, or even the milder form of depression called dysthymia, 10 to 15% is due to a thyroid problem, which is quite disturbing to know, because a lot of people come to us with severe depression, treated for depression outside without basic blood tests being done. And a year or two later, we find that they had simple hypothyroidism. You treat the thyroid disease, the depression is well under control. So depression is a common side effect that we notice.
So it is like it's ranging, like it's prevalent, or how is it?
So depression is quite prevalent in thyroid disease, about 10 to 15%. Thyroid, on the other hand, hypothyroidism is quite prevalent in our population. The estimates are that if you take 1 lakh people, or 1 lakh population, approximately 15 to 30% can have some form of thyroid dysfunction, whether it comes out as clinical features or it can be subclinical. Subclinical means you don't have all the symptoms, but your lab tests show that you have a thyroid dysfunction, and these patients need following up. So approximately 1/3 of our population could potentially have some form of thyroid dysfunction.
Wow. Okay. So when we say 30%, so it is actually, is it genetics or is it lifestyle? What exactly is the major cause? What is the culprit for this?
Okay. So till about, like I mentioned earlier, for the last 2 decades, the most common cause used to be iodine deficiency. Now, iodine, as we know, is a common mineral that we all have heard of or read about. It's very important for thyroid hormone, that is thyroxine production. And we normally get iodine from our diet. But in developing countries, they have noticed that iodine deficiency is quite common. And iodine deficiency was the most common cause of hypothyroidism till recently. I don't know if you remember, but there was maybe about 10, 15 years ago, iodized salt became the norm. Right. The reason for salt having iodine was purely to treat hypothyroidism. Because in India, they found that pregnant mothers who were giving birth to children who had hypothyroidism at birth, and that leads to brain dysfunction and the child having a lot of cognitive impairment. To avoid this, the government decided to iodize all salt, and every person who buys salt was advised to buy iodized salt so that you have a basic amount of iodine intake per day. Unfortunately, in the last 5 years, the spectrum has changed towards autoimmune thyroid disease. An autoimmune disorder is any disorder where the body attacks itself. And that's why, if you notice, the most common period for thyroid is between 20 to 40, because autoimmune diseases are common between 20 to 40. And this is also the reason why women have thyroid disease more than men, because women are much more susceptible to autoimmune diseases than men. So autoimmune disease where the body's own immune system damages its own thyroid is now currently one of the most common causes of hypothyroidism nowadays. Rarer causes might be drugs. We use a lot of drugs, especially some of the drugs we use for heart disease, some of the drugs that we use as antipsychotics or in the psychiatry department can also affect the thyroid. In places like Hiroshima, Nagasaki, or places like Chernobyl, where there was a lot of exposure to radiation, radiation is also known to cause thyroid deficiencies. So the most common cause now is autoimmune, followed by iodine deficiency, and then you have a few miscellaneous causes. We also have some surgical causes where sometimes the thyroid is removed for enlargement, and they can develop hypothyroidism after that. But these are the two most common causes of hypothyroidism. Now, most autoimmune disorders do have a genetic basis. In fact, the genetic basis for thyroid disorders may not be just thyroid disorders. For example, a young girl comes to me at 20 and I've diagnosed her with an autoimmune disease. And I say she has autoimmune thyroid disease. I ask her in her family that does anybody else have thyroid disease? You may not get the history that, yes, my mother has an autoimmune thyroid disease. My sister is suffering. My uncle and aunt are suffering. But you will get a history that they have some other autoimmune disease. For example, rheumatoid arthritis, which is a disease of the joints. Or they can have an autoimmune disease which affects the gut called celiac disease. So you will have to question not just thyroid dysfunction, but autoimmune diseases in the other members of the family. So not every member can have the same autoimmune disease, but most members can have some type of autoimmune disease, which you have to question. So genetic basis is quite important nowadays in thyroid dysfunction.
So can that be taken, like when you said that there's a deficiency of iodine? So can that be rectified with iodine, or it cannot? It has to go through the proper treatment.
So that's a very valid point. Everybody requires a basic amount of iodine per day. 150 microgram is the recommended dietary allowance, irrespective of how you take it. When you have a thyroid disease, we always advise iodine intake, and we ask them to increase their iodine intake. But this is only in supplement to medication, because until you get their thyroid hormones under control, iodine is only a supplement that you give, and they have to continue taking iodine lifelong. Now, the problem with this is you cannot take excess of iodine. It's not like a multivitamin where, okay, I'm not feeling well, let me pop 3, 4. If you take excess iodine, in fact, it further reduces thyroid hormone production. It's a very paradoxical thing that happens. So you have to take the exact right amount of iodine for you to have adequate thyroid function. So 150 microgram is the recommended dietary allowance, which you take either as iodized salts, or you take in any food form. For example, fish or marine life is very rich in iodine. Salmons, shrimp, fish are very rich. For vegetarians, lettuce and to some extent spinach are supposed to be good sources of iodine, as well as nuts. So you can balance the intake based on this when you have, but it is always in addition to medication.
Okay, so when you said 150 mg, that is like across all age groups or anything specific?
Yeah, so generally it's 150 microgram across most age groups. In pregnancy, it might go up to about 200 microgram. And in children and adolescents, we prefer about 100 to 125. But 150 is the minimum requirement standard across most age groups.
On an average, isn't it?
On an average, yes.
Okay. So this would definitely affect the weight problem, regardless. Correct?
Yes. So that is I find the biggest challenge with my patients who have thyroid dysfunction is to tell them to monitor their weight. Now, when you start developing symptoms of hypothyroidism, weight gain is very common, like I mentioned earlier. What is more difficult is losing that weight. Though I give you thyroid supplements to control your hormones, the weight loss is often the biggest challenge for patients who have thyroid dysfunction. So a lot of questions to me are, doc, I feel so tired all the day. My legs are swollen. I've got severe thyroid dysfunction. How do you expect me to walk? And my answer to that is, unfortunately, that you have to have a minimum amount of 30 to 45 minutes a day of walking. That is isotonic exercises. But you can also do some low intensity weight training as well, which is non-impact on the joints. This is very important because what a lot of people don't realize is if you have hypothyroidism, that is thyroid dysfunction, or reduced thyroid hormones, your muscles become weak. So you have to engage all your muscles. Otherwise, they develop severe joint stiffness. And you find that your exercise capacity drops dramatically. And losing weight is often the most difficult. So I tell all my thyroid dysfunction patients that give me about 6 to 10 weeks for my supplements to work, because it takes about 10 weeks for the tablets to work. After which you have to push yourself to maintain a basic fitness regimen. This has to be 30 to 45 minutes of a walk at least 5 days a week, along with isometric training at least 3 times a week is compulsory. It is painful, it is difficult for the patient to do, but it is essential because the exercise itself increases your basal metabolic rate. When you have very low thyroid levels, your body metabolic rate is extremely low.
Yeah,
exactly. So the body slows down. You have to match that with adequate amounts of exercise, because if you don't, then it leads to joint stiffness, it leads to loss of muscle memory, and it leads to, it becomes a vicious cycle. You have thyroid, you don't exercise, your weight is not going to come down. It leads to frustration, it leads to joint involvement, it leads to arthritis. So it's extremely important to do. On the other end of the spectrum, when you have high thyroid levels, hyperthyroidism, which I was mentioning earlier, your heart rate and basal metabolic rate is quite high. So exercise should always be done with caution, because if you increase your heart rate to unnatural levels, it can lead to heart dysfunction. So any patient who has thyroid dysfunction must visit not only a physiotherapist and a nutritionist, but also they must have a possibility of, must have a physical or a personal trainer to guide them through their exercise loss regimen, to their weight loss, I'm sorry.
Okay, so when you're talking about the metabolism, right? So obviously they cannot go and do the strength training, because I believe that if the more muscles that you have, it's more fat that you keep burning. So you won't have that difficulty in burning the fat. So how is the strength training be more beneficial for people who have the issue?
Yes. So what they've said is that once you start off with basic walking and cardio, basically cardio exercises, it increases your heart rate, it increases your basal metabolic rate, and tries to help you overcome the side effects of thyroid. It's not going to treat your thyroid dysfunction, but helps to overcome. But what they found is long-standing thyroid dysfunction leads to loss of muscle fibers, because thyroid or thyroxine is required for muscle metabolism as well. So when you have a long-standing thyroid dysfunction, you can lose muscle mass on the long run. Not in the short run, as you rightly said, it's more of fat and water retention. But in the long run, they can lose muscle mass. And once you start losing muscle mass, you start losing, bone strength. You start losing flexibility. Your joints become stiffer. So that's why they encourage not only a mixture of pure cardio that is isotonic, but they also recommend low impact, low intensity muscle training at least twice a week. That is just to ensure that you don't lose muscle mass in the long run. Because if you have an autoimmune thyroid disease, it's a lifelong problem. It's not something I can give you 6 months of medication for and say you're cured. They often require treatment lifelong, and hence changes in their lifestyle and their exercise regimens are must to prevent muscle loss.
So why, when you said that, what are the steps they can actually take it? Like, so when they have this, when they have found that they have the issue, so firstly, obviously they'll come to you, they get the medication. So you said about you're going to give them few weeks for the medicine to actually, get into their body, get into the system. So once that happens, what are the steps that you could possibly suggest them to, start off with the process of, losing weight or getting that health paradigm?
Excellent. So this is something that's critical. A lot of times as doctors, we assume that once we write our prescription and give it to the patient, our job is done, which is not true.
Correct.
It's so important to address all these other questions and queries of the patient. Right? Not all patients are Google savvy to do it themselves, or they might, Google it and get even more scared. But generally, as a doctor, it has to be a holistic approach, not only just for thyroid, but for all diseases. So what I advise my patients who come to me with weight gain and all the symptoms of low or high thyroid, which I mentioned, we initially get some blood tests done, a basic thyroid function test, which includes the hormone panel. We also check them coincidentally for their cholesterol levels, because low thyroid function or hypothyroidism commonly causes cholesterol elevation. We also check their sugars and their blood counts as well, because those can be coexisting with thyroid dysfunction. Once we establish that they've got a thyroid disease, and most cases are hypothyroidism, so I will talk about that, So assume your thyroid is not functioning properly. It's functioning subnormally. I usually start them on supplements. Once I'm assured that they're symptomatic. A lot of patients come to me with reports showing hypothyroidism, but no symptoms. They do not require treatment, they require follow-up. But patients who have symptoms and abnormal thyroid function tests require treatment. So once I start them on medication, I give them a treatment plan. So I give them about 6 to 10 weeks for the medications to work, which is the minimum before they can feel any change in the body. Okay. I encourage them to start walking as early as possible. So I tell them that the medications are only, 50 to 60% of the problem. 40% is the patient's effort. So I give them the medication and tell them to start walking every day. Even if they can start at 10 to 15 minutes or even up and slowly titrate it up to 30 to 45, that's absolutely fine. If they are patients who are not used to exercise, we have a lot of patients who are sedentary, I encourage them to start even with a 10-minute walk, and slowly every week hike it up by 5 minutes till they reach 30 to 45 minutes. And I tell them that this is going to become part of your life. Walk a day, 5 days a week.
Start about 10 minutes, from 10 minutes, right? So
yeah.
When they're going to start from 10 minutes, like you're going to talk about this in a day, correct? So this is like in a day,
yes.
they're going to take about 10 minutes.
Yes.
So will that actually make a significant impact in their everyday life? Because obviously it's going to be a part of their everyday life. Okay, it's physical activity is like a mandate for like across forever.
Yeah.
But will that 10 minutes on the initial stage, will that make an impact on the body, or is just to set the mind?
So you're absolutely spot on. It's more to set the mind to starting. A 10-minute walk a day is not sufficient enough to push your metabolic rate up or your heart rate up enough for the target that we want. But if I tell a patient to walk who's never walked before, who's a sedentary homemaker, or a person who's a teacher who's used to just sitting in the class, and I tell them, start walking 45 minutes a day, he's going to look at me and say, I've never done this before. And with my thyroid symptoms, you're expecting me to start 45 minutes. It's more of a mental block. So by starting them with small goals, like with anything with the human mind, you have to trick the human mind a little bit. So tell the human mind 10 minutes this week, 15 the next week, 20 the next week, and slowly build it up. But you also mentioned very rightly, in elderly patients, who have thyroid dysfunction, they can also have underlying heart issues. So it's always better to start slow and at a low pace for a short duration of time and slowly build up based on their capacity. But majority of patients, it's a mental thing for them to build up confidence that, yes, I can reach 45 minutes, which is the target, over a few weeks.
Right.
So once I get them to do this, exactly. And once I get them to do this for about 6 to 10 weeks, the thyroid medications would have kicked in by then, they'll start feeling better. And then I tell them, this is going to be part of your life. You have to walk for this much duration for 5 days a week, at least 30 to 45 minutes. And if they're young, energetic, or they're people who are used to going to a gymnasium to work out, they're used to CrossFit, or they're used to the various other exercise regimens out there, I encourage them to start their exercise regimens under monitoring, because I don't want them to have any untoward incidents. So I always tell them that it has to be done under monitoring, not only of me, but also a physiotherapist or even a personal trainer, in order to ensure that the appropriate exercise for the correct duration of time is done. So this is the exercise part of it, and I tell them it's a must. In addition, a lot of questions come on to, what about lifestyle changes?
Right.
What do we do about our lifestyle? I'm used to this type of food, I'm used to that type of food, what do I do about it? That's a very important question. And over the years, many studies have come out of what foods are good and what foods are bad. Initially there was a huge thing where we banned cabbage, broccoli, and cauliflower and said you can't eat it at all.
Right.
But that has changed now, because even kale, which is the fad nowadays to have kale, they said kale can worsen thyroid dysfunction. But the American Thyroid Association has said, no, you can have it in moderate amounts. You don't have to completely ban it from your diet, but it can't be your diet every day. You can't have the same vegetable, that is cabbage, cauliflower, kale, broccoli, every day. Once or twice a week in moderate amounts is absolutely safe. And the foods that I mentioned earlier, poultry, some types of legumes, some types of nuts, palak, lettuce, those are all very useful sources of iodine. And especially for vegetarians, it's very difficult to prescribe. So you tell them to increase their legume intake. You say spinach and palak become something that's very, very important. Sorry, spinach and lettuce become very important to intake at least 2 to 3 times a week to mention basic iodine requirement. So cabbage and cauliflower, the myth about cabbage, cauliflower and broccoli is that you can consume it once or twice a week in moderate amounts. You don't have to avoid it completely from your lifestyle. So by telling them their diet, telling them their exercise and medications, it's a 3-pronged attack to a thyroid dysfunction, which is good.
So how will the person actually come to say, there are stages, I believe. So there are like type A, type B. I'm not kind of sure about it. Can you just give a little bit of insights about that?
Sure. So you have something called a subclinical thyroid dysfunction, where you may have some symptoms or no symptoms, but your thyroid hormones are abnormal. Okay. This can be a transient phase, or this can be a phase which is a precursor for full-blown or overt thyroid dysfunction. So catching people in the subclinical phase is only done when you screen them for thyroid dysfunction, because a lot of patients will not have any symptoms, but when they do a master health check or they check for something else and they happen to do a thyroid disease, a thyroid panel, you pick up a thyroid dysfunction. Now in this stage, what I generally do is, unless they have symptoms of thyroid disease or they have some other co-illness, which, like for example, a heart disease, where thyroid dysfunction can contribute to worsening it, then I consider treating them. But if they don't have any symptoms, I ask them to repeat their thyroid functions after about 6 weeks or 3 months and come back to me. But in that meantime, I tell them to monitor their weight, get into an exercise regimen, and just modify their diet to some extent to just keep a control on it. And regular follow-up, if these patients remain subclinical and asymptomatic, no treatment is required. But once they become overt, that is, their thyroid hormones become grossly abnormal, or they start developing symptoms of thyroid dysfunction, then we call it overt or clinical hypo or hyperthyroidism, in which case they have to be on medications, along with, of course, lifestyle and exercise, but mainly medications is required. So finding the subclinical cases is often, you fall upon it when you do some blood tests, but clinical cases require treatment irrespective.
Okay. So also, Doc, you were talking about the hormonal imbalance, right? So this is predominantly has to do with the stress, which is the cortisol or the insulin and everything in together, or it's just very specific towards it? Because I believe that towards the weight loss journey or fat loss journey, these hormones play a very, very important role when it comes to, the diet and the lifestyle. So
very important. That's an extremely valid point. So we don't look at the thyroid gland in isolation. It's always related to the pituitary gland, which is the master of all our glands, which is present in the brain. We also commonly associate it with cortisol, as you said, which is secreted from our adrenal glands. So the endocrine glands form a very well-connected network which secrete hormones in various ways. And hormonal interaction is something that is very key. As you rightly said, in the fat burning journey, cortisol plays an extremely important role, not only in your weight loss, but also your appetite and your general well-being.
Right.
And they found that patients who have thyroid dysfunction can also have cortisol imbalance. They can have low cortisol, which can cause them not to put on muscle, or they can have high cortisol, which is much rarer, where they fail to lose weight. And they found that the thyroid, once you bring the thyroid under control, automatically the cortisol will also subside or come under control. It's very rare that you need to treat the cortisol imbalance separately. And they found that there's a very close correlation between these two. It's only about 1 to 5% of patients who have deficiency of both cortisol and thyroid disease need treatment for both. In the case you give steroid hormones on one side and thyroid supplements on the other. But in 85 to 90%, if you can control the thyroid dysfunction, the changes in cortisol will settle over time. Okay. But yes, this is a very important contributing factor to lack of weight loss when you have hypothyroidism.
Okay, that also includes insulin as well, right? If I'm correct.
Yes. So insulin is another important hormone, as we all know, for sugar control. And they found that patients who have hypothyroidism commonly have higher levels of insulin, and they can even develop something called insulin resistance. Because in thyroid disease, you deposit abnormal amounts of fats and various proteins in parts of the body. They increase the resistance of your own body to the actions of insulin. And often this can lead to a pre-diabetic state. there's a common correlation that patients with abnormal thyroid function can have high levels of insulin because of insulin resistance, and eventually this can predispose them to develop diabetes in the future. And that's a very important correlation. So that's why, again, now you know why exercise is so important.
Right.
You start doing that basic amount of exercise, you reduce your insulin resistance, you allow the body to respond to native insulin. It prevents you from progressing to that pre-diabetic stage as well.
Mm. Right. I mean, with current lifestyle, which is a sedentary lifestyle, people are finding it really difficult, because it actually takes just about 15 to 20 minutes or even 30 minutes to even take care of the body. But if people are finding it really difficult to even just to do that. So it's more of like, I don't have time, or I can't find the time. It's all about making the time to, do it, because
Absolutely.
these small steps is going to make a big compound effect on your body after, when you reach 40, 50. If
I couldn't have put that better myself. It's so easy to get lost in the mayhem of the 21st century, where I'm so busy, I have my social life, I have my personal life, I need my me time. And I find it strange when you say you have your me time where you want to sit with a cup of coffee and, Netflix, but you can just spend, as you rightly said, it's just 15 minutes of, even at home. And nowadays with the exercise regimens, which are, no weights, you don't need weights, you can just use your body weight,
right,
and you can do a whole lot of things. I mean, the sky is the limit with respect to physical activity. And I find it strange that when people say that we want my me time, but they're not willing to spend even 20 minutes on just basic exercise, and it's not just for thyroid, it's for diabetes, it's to prevent osteoarthritis, it's to prevent stroke, heart disease, kidney dysfunction. If you look at every guideline, every single guideline will mention exercise is required. There is no guideline that I know which says, please don't exercise, it makes it worse. So I think exercise is, and like you said, just 20 minutes a day is more than enough.
Right. So speaking of the 20 minutes a day, so can we suggest HIIT, the high intensity training for people who have this issue? I mean, obviously overweight people cannot do this HIIT, which is given, but otherwise can we suggest it?
So again, like you rightly said, patients who are overweight, elder, obviously people above the age of 60, people who have thyroid hyperactivity, hyperthyroidism, it's not advisable unless they've been cleared by their treating physician.
Okay.
People with hypothyroidism, HIIT can be suggested once they've brought their thyroid levels under control. Okay. The reason I say this with medication, the reason I say this is if they started off in the beginning, sometimes because of the muscle pains and the muscle fatigue, they often discontinue because it causes them more discomfort than anything. But once their thyroid is brought into a stable state, they are compliant to their medications. HIIT is not a contraindication in patients who have hypothyroidism. In patients who have hyperthyroidism, we generally don't advise them to go and undergo HIIT, as well as obese people and elders above 60. But everybody else, once their thyroid is under control and they get a clearance from their treating physician, HIIT is also not a problem to be done.
Awesome. So very important question. Like, is there any permanent cure for the thyroid, or it's?
So this is something that all my patients ask me and say, doctor, how long do I take the meds? Am I going to be back in 3 months, 6 months? Well, it's a dicey situation to comment on that, especially at the early stages. If it's due to iodine deficiency, or if it's a drug-induced thyroid dysfunction where you're taking medications for some other illness which has suppressed your thyroid gland, it's completely remediable. In fact, patients with iodine deficiency, you supplement the iodine in 6 months or a year, often the thyroid dysfunction can disappear and they can be tablet-free. But if it is autoimmune, if it's an autoimmune disease, or if it's a disease where your thyroid has been exposed to radiation, or you had a surgery where the thyroid has been removed for whatever reason, unfortunately, medications will be required lifelong. The dose of the medications vary. Once we play around with the medication dose based on the patient's response, we reach a minimum dose where the patient is comfortable and we continue that dose. Unfortunately, in autoimmune diseases, there are a very small percentage of patients who we can stop it for and say, okay, you're cured. A majority do unfortunately require lifelong medication. But that being said, I have seen patients who, with the right exercise regimen, with the right diet, and strict adherence to what I say, have become normal and have been off medications for a good number of months or years without a recurrence as well. It again varies from personality to personality. It varies on how intense they are with their control themselves, how dedicated they are to fitness regimens. I wouldn't say it's impossible, but I would say it's difficult if you have an autoimmune disease for your thyroid to come under control. But like I said, given all the current regimens, the impossible can be made possible, and the sky's the limit. So you can bring it under control, and it's only a single medication a day, which has almost no side effects. And often patients learn to live with it. So it's eminently controllable, but to declare a cure, not so common.
Okay, it's not so common. Okay, that's.
It's not so common for me to stop patients on their thyroid, especially if it's autoimmune. If you give me 100 patients of hypothyroidism, I would say about maybe 10 to 15 of them I could stop completely. About 80 to 85 I would continue. But again, I've had cases I've told them you have an autoimmune disease, you will require lifelong medication, and they've surprised me. They've come back to me and said, sir, you said lifelong. I'm off the tablets for 6 months. My thyroid is pristinely normal. What do you say to that? And I say, you're a lucky person.
So, Doc, off the topic, I just want to ask, like, not off the topic, but then how is a placebo effect plays on this thyroid? I don't know if the question is relevant, but if I can just ask that, what would be your insights on it?
It is actually, you're quite right, because I find that a lot of patients who start their thyroid medications get very wary when I reduce the dose. Because they're so used to that dose. When I tell them, look, your thyroids are well under control, let me reduce your dose, they're like, no, sir, please, don't touch it. Often placebos are useful in some cases, especially when you give them a multivitamin which contains iodine, which is the common practice in not in big hospitals or big metros, but you do have supplements, multivitamin supplements which have iodine. And often you give that to patients and say, look, this is going to improve your own body. It's a natural way. Some people really do use it and do find relief. And especially if you tell them natural ways to do it, natural placebos, you address their diet issues, you address their exercise issues, it does work. But overall, placebos have some effect in some patients, but most patients nowadays are too smart for you to try it without them figuring it out.
Okay.
Yeah.
Okay. So when a person is coming to know about it, how will a person come to know about this, or what is the exact stage for anybody to take a like a medical help? What is the right time?
So if you start suffering from symptoms, when you wake up in the morning, you find your face extremely puffy, you've noticed a voice change, you've noticed that your legs swell up by the end of the day, both your feet are swollen, you've put on weight, but you've not noticed any change in your diet, or if you're exercising and you're exercising hard, but you're not losing weight as you should, or if you're a woman and you have irregularities with your periods or your cycles, sometimes women are unable to conceive in a marriage, sometimes depression, which I mentioned to you earlier, you come with unexplained depression with no stimulus. Some men can have erectile dysfunction as well. You come with all these type of symptoms which are not settling in the last 2 to 3 months, you can visit a doctor for a test. One of the most common symptoms which I have seen is fatigue. Wow. They come and say, doc, I have no other symptoms, but what I used to be able to do a year ago, I just can't. I can't do my physical activity at home. I'm unable to do my housework. I can't go to the gym and run like I used to. I'm not breathless. I've not got any other issues. I just feel lethargic. I feel tired. My mood's always low. I always feel drowsy. I feel like sleeping. These are the common symptoms that they come to us with. And we generally do a test. Another important cohort of people are pregnant women. All pregnant women have to be screened for thyroid dysfunction because it can have deleterious effects on the fetus. So if you come with all these symptoms, you visit a physician, we always get thyroid function tests done. It's important to address all these early on so we can pick you up in the early stages and treat you so that it doesn't become a stage where you require high doses of medication.
Wow. Okay. So when you said that, so it is like always an inconsistent pattern, or it's a consistent pattern? Like when they say, when you were talking about the swelling of the face, So is it like consistent, or at the initial stage it will be very inconsistent and then eventually it will be growing up to a position
Yeah.
where it can't
So,
handle it?
so it starts off inconsistently. They might say, so once or twice a week, I get up with some facial swelling. And they often attribute it saying the previous night I didn't sleep well, so my eyes are a little puffy. But eventually, over time, once you go into the full-blown stages of the disease, it becomes a consistent symptom. And often relatives and family might say, hey, your face is always swollen in the morning, or why are your legs so swollen?
Right.
Your voice seems to have become a little thing. Dry skin is another common symptom. They come with extreme dry skin, or they come with constipation. So these are all symptoms which you pick up early. We can tackle the disease early. They're initially inconsistent, but once it becomes a full-blown thyroid disease, they become quite consistent.
Mm-hmm. Okay. So this was a question, Doc. What is a possible line of management of this approach?
Yes. So like I said, about 40% is exercise and the right diet and the right motivation to deal with a thyroid dysfunction. We generally prescribe thyroxine supplements in patients who have low thyroid, hypothyroidism. We give them thyroxine supplements. These are calculated based on your weight as well as your improvement with medication. They're a single tablet to be taken every morning. We prefer to give it in an empty stomach, preferably about 30 to 60 minutes before your breakfast. Or if you've had your breakfast, you can take it 4 hours after the meal, but we prefer an early morning tablet. We take about 6 to 10 weeks to see how it's working. And based on your hormone levels, we can either increase if you're not doing well or reduce the dose based on how your body responds. And this has to be continued. So it takes us about a good 3 to 6 months to come to the basic minimum dose that you need for your body. Because we initially started a particular dose, then we have to increase it or decrease it based on your hormone levels or your body's response. It takes me a good 3 to 6 months to adjust the final dose that we require. Now with this, there are minimal side effects with the thyroid tablet. We just caution that you don't have it with your other tablets. For example, you're taking calcium supplements or you're taking iron tablets. We don't allow them to take it with that. And sometimes people don't advise taking the tablet with soy. So if you're on a soy diet, soy milk or soybean, we avoid taking the tablet with soy because soy can interfere with its absorption. But apart from that, it's an absolutely safe tablet to take. But if you have excess thyroid, where you have hyperthyroidism, the treatment is to suppress the thyroid function. So we give you certain drugs which reduce the thyroid production. And those take a little longer to work and those are a little more difficult to titrate. And for them, we use either medication or sometimes if you have hyperthyroidism, where your thyroid is functioning abnormally, we can either remove the gland, either medically with the medication or do surgery to remove the gland, thereby making you from a hyperthyroid state to a hypothyroid state. That's another thing that we commonly can do. Dealing with hyperthyroidism is a little difficult. Hypothyroidism is much more common, but also much more satisfying to treat because the response is quite dramatic. In addition to medication, you require a thyroid function test. Initially, we do it once in 6 weeks. Once you stabilize, we do it once in 3 or 6 months and just titrate your medication based on that. But also we tell our patients that exercise, diet, monitoring your weight, monitoring your menstrual cycles, getting good mental stress relief is important. Because not only does thyroid cause depression, but a diagnosis of thyroid dysfunction, telling a patient you have to live with thyroid dysfunction lifelong, is often very depressing and is very distressing to the patient to say, what did I do to deserve this? Or like you rightly asked me earlier, is it curable? And when you say it's controllable but not curable, often they take it quite badly. And that becomes a vicious cycle where they become more depressed. So giving them mental stress relief is extremely important. I always tell them I give them reading material. I also tell them to do some amount of yoga to relax the mind. Some amount of meditation will always help to calm the mind down. And I tell them to avoid thinking about it. I said it's one tablet a day. Take it like you take a multivitamin and leave the rest to fate and us. So that's my usual advice.
Right. Okay. So Doc, one personal question, if I can ask. Okay. So this is like, I was just thinking about this and I have framed about 4 or 5 questions and I just wanted to select one. Okay. So what is the impact that you want to have in the world?
As a person or as a doctor is an important question.
So let's make it 2 questions then.
Fine. So as a doctor, I'm a physician, internal medicine specialist, but my subspecialty is blood and blood cancer. That's my work. That's my field of interest. So
Okay.
I deal with not only internal medicine, but I deal with a lot of patients with blood and blood cancer. And what I want to do, or how I want to impact the world, is to ensure that diseases of the blood and blood cancer is something that can be fought, and something that I think should be really addressed properly. And I hope that treating blood cancer, which is my passion now, is something that I'll always retain, and help as many people, because especially in a country like ours, I've noticed, unfortunately, that a lot of my blood cancer patients discontinue treatment purely because of one thing, and that's financial stress. I've had patients discontinue treatment despite giving them a 60% chance at survival, saying, "Sir, 60% is not a good enough number for my family, for them to spend so much on me." And these are facts. And I've had patients who stop treatment saying, "Sir, it's either paying for the chemotherapy or paying for food to feed my family." And when you're faced with such questions, it's beyond ethical and moral debates. You just can't. There's no right answer to that question, and there's no right answer to that debate. And so I hope to make an impact where I I can't reduce the burden of cancer, but make blood cancer and disorders of the blood much easier for patients to deal with financially, and also help them deal with it both socially and mentally, because it takes a lot of stress when you have a blood disorder or when you have blood cancer. There's such a dearth of support for patients. And as a doctor, it's easy for me to prescribe medications and close my eyes and walk away to the next patient. But it's important for everyone out there to understand the impact that this has. And so I hope I can do better by my patients and help them as much as I can in all ways possible, because ultimately they're the ones who need the most help. That's on a doctor front, which is the glamorous front to comment on. As a person, I think, given how Corona has kind of affected everybody across the world, I think being more socially, more environmentally responsible is something that I would like to impact and like to influence people around me to be. I find that nowadays we're so selfish, so worried about I, me, myself. There is no, worry about people around you. And I've
Yeah.
seen this not only among my profession, but generally the world around, where I find that our responsibility not only to Mother Nature and the environment, but our responsibility to society and people around us is dying. And I think that is something that I would like to restore and make sure that as a person, I'm socially and environmentally responsible, and also make sure that everybody around me, does the same, and that we can, strive to be a better race and and live in a better society, definitely. Also, I think kindness to everyone around us is something that's really lacking. I mean, nowadays you see acts of kindness being glorified on social media because they're so rare to see.
Right.
The media always portrays all the bad. When you suddenly see someone doing good, it's portrayed, it's blown out of proportion. People find it relevant or needed to photograph themselves doing a kind act to make sure the public realizes that yes, there is still good in the human race. I find that negativity towards our race and society quite unnerving. And I think to restore that kindness in society and kindness in humanity and compassion is something that's really, really essential. And I hope I contribute a minuscule amount to that.
The world needs more people like you, Chaitanya.
Thank you so much. I really
A lot
appreciate
more.
it.
But yeah, on that note, thank you so much for your time, Doc. I hope that you continue to contribute for the world, and thank you so much for your time.
Thank you so much. I really appreciate you having me and talking about something that's so relevant nowadays and so important. And what I loved about the questions that you asked is, you didn't ask me, Doc, how much is the tablet going to cost? What are the tablets used for? What are the side effects? You asked me the impact on the person. And this is something everybody forgets. Don't treat the disease. My boss, when I was doing my MBBS and my MD, he said, Chaitanya, the one key thing to being a good doctor is that you should be a good human being first. You're not treating a disease. You're treating a patient. You're treating a human being. And that's something we forget. We're like, okay, he's got thyroid disease. Let's treat it completely. Our job is done. No, you're a healer first before a physician. And you have to treat the person. You have to treat his problems. And like you rightly said, these are questions that patients don't have the time to ask me in my busy OPD. But I feel these questions are essential to be answered for anybody. And I'm so glad you brought them up, because these are critical areas that really doctors need to address in addition to just writing a bunch of tablets.
Right, because many of my customers, many of my people who are asking me, I've got a lot of people in my tribe and my ecosystem. So people who are coming, I have this thyroid issue and I'm finding it really difficult to do it. So I know the type 1, type 2, type 3, that's it, but just on the surface level, but not on the very in-depth level. So I need an expert. So that's where you came in, and then you rock the show.
No problem, and hope to collaborate with you further. Thank you so much.
Absolutely. Bye, Doc. Bye.
Take care. Bye.